One common treatment in equine sports medicine might work partly by making the horse feel less pain. So, shockwave therapy has become a popular treatment for suspensory injuries, tendon injuries, arthritis, navicular syndrome, and back pain. But how does it actually work? Hi, I'm Dr. Rebecca Douglas, and I've been practicing acupuncture and Chinese medicine on horses and humans for over 22 years. Today, again, we're looking at some recent research, and this research suggests shockwave may have three major effects. So let's start with a part that often gets overlooked. Number one, shockwave appears to temporarily alter nerve function and pain signaling. Researchers have found evidence that it can affect myelinated nerve fibers and change the way pain signals are transmitted. In some cases, the treatment area becomes temporarily desensitized. And that's why many racing and competition organizations prohibit horses from competing for 7 to 14 days after shockwave treatment. The concern is that a horse may feel better before the tissue is actually healed. If a horse is less painful, it might be willing to work harder and overload an injury that is still recovering. So that raises an important question. Is the horse moving better because the tissue is healthier or because the horse is feeling less pain? The second effect to look at is inflammation modulation. So, shockwave appears to influence multiple inflammatory pathways and may help shift the body toward a more balanced healing response. Researchers found changes in inflammatory cytokines, signaling pathways, and in even immune cell behavior that may help limit excessive inflammation while supporting repair. The third effect is where things get really interesting. Shockwave appears to stimulate several processes involved in tissue healing. Studies have shown increased blood vessel formation, increased nitric oxide signaling, and increases in growth factors that are involved in tissue repair. In suspensory ligament studies, researchers found increased collagen fibers, extracellular matrix production, proteoglycans, and cellular activity within the injured tissue. In simple terms, the tissue appeared more metabolically active and engaged in repair. But here's where I think we need to be a little bit careful. Many studies show that horses become less lame, more comfortable, and they return to work. What we don't always see is clear evidence that the tissue itself has completely regenerated or returned to normal. In one osteoarthritis study, lameness improved significantly even though cartilage and joint pathology showed little change. So a more accurate way to think about shockwave is that it changes the biological environment in a way that supports healing. It may improve blood flow, influence inflammation, stimulate growth factors, and encourage tissue remodeling. But it doesn't replace rehabilitation, management, or addressing the underlying cause of the injury. We still have to ask what caused this injury in the first place, and has that been addressed?